Foundation Podiatry. So just continuing on with our forefoot pain series, and today I'd like to talk about Morton's neuroma. So a Morton's neuroma is quite a common cause of forefoot pain, and it's characterized by nervy symptoms. So quite often a burning or a numbness or a tingling pain, okay? So we'll feel this pain in the ball of the foot, and it may extend through to the toes, okay? Now, so we have nerves running through our feet that run in between the metatarsals, okay? And sometimes these nerves will get compressed. So the body's response to that is the nerve tries to protect itself by building up a bit of a scar tissue thickening, which we call a neuroma, okay? Now, the bigger the neuroma gets, the more easily the nerve gets set off, okay? Now, as I said, it's normally between toes 3 and 4, okay, or metatarsals 3 and 4, affecting toes 3 and 4. But it can be in other areas of the forefoot as well, okay. Now, reasons we get a neuroma, often footwear is a biggie. So if we are squeezing our feet into tightly fitting footwear, then this puts compression on the forefoot, which compresses the nerve and can cause it to become aggravated, okay? So I'm not just talking about the width of the shoe here, but also narrow pointing shoes will set off that nerve. Now, another cause is the type of activity that we do. So if we are doing a lot of walking or running where we're constantly putting our forefoot in contact with the ground, so the repetitive activity may cause the neuroma to occur, okay? Cycling is a biggie, generally because we're shoving our feet into tight-fitting cleats, and then the forefoot is in contact with the cleat the whole time we're cycling, so it's not getting a break. Okay, another one is the elliptical trainer at the gym for the same reason. The forefoot's in contact with the ground the whole time. So as well, certain foot types may increase your risk of getting a neuroma. So that might be a overpronated foot type, so a collapsed arch, allowing the forefoot arch to collapse, which puts more load through the forefoot. Sometimes a dysfunctional big toe, so whether that be a hallux valgus or a hallux limitus, meaning the big toe is not able to do its work properly and we end up overloading the lesser toes, okay? So to help with neuroma pain, quite often we will obviously have to address the footwear first, that's a big one. But sometimes we may need to do something inside the shoe, like a metatarsal dome, to increase the space for the nerve to run through, okay? So there's a few things that we can do that can be quite effective there. Depending on your activity, sometimes a foot orthotic is needed to control the sort of abnormal function. And then if a neuroma is quite large in size, sometimes the sort of more conservative treatments no longer are helpful, and that might be where we need to look at an injection, whether it be a saline injection or a cortisone injection, okay? And ideally surgery is not needed, but in some cases it is. So that's a bit of info on a Morton's neuroma, which is only one of the many different problems that can occur in the forefoot. Thank you.